Recording in progress.
Good morning. Thank you for joining us for today's press conference. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one per outlet today, and we are limited to 45 minutes. If there are remaining questions in the queue when we conclude and you feel your question hasn't been answered, please submit your questions in the chat or by email, and we will work to get you a response in writing. We'll begin in just a few moments after we finish granting recording permissions. Okay, all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. And Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, good morning, and thank you for joining us again today. I'm Dr. Vanderhoff, Director of the Ohio Department of Health. As we've discussed before, since the beginning of our experience with COVID-19 2+ years ago, developing and providing effective vaccines has been a cornerstone of the effort to protect us against this virus. The first vaccines became available in December 2020, and throughout 2021, vaccines gradually were approved for almost all age groups. The one group that has still been waiting has been our youngest children, those less than 5 years of age, and now that appears likely to change. On Wednesday, the Vaccine Advisory Committee to the U.S. Food and Drug Administration voted unanimously to recommend approval of Pfizer's application for a vaccine for those ages 6 months through 4 years old, and Moderna's application for a vaccine for those ages 6 months through 5 years old. Next, FDA leadership is expected to issue its approval. On Friday and Saturday, the CDC Advisory Committee will meet to make recommendations for the vaccine's uses. The CDC director must then approve the committee's recommendations. Although we, of course, do not yet know what the CDC will recommend, typically, the CDC has acted in concert with the FDA. In anticipation of this, Ohio's enrolled vaccine providers have begun placing orders for these vaccines, and the first deliveries are expected on Monday. The state has a robust network of vaccine providers, so parents will have many options to access these shots. Providers, including pediatricians, family physicians, hospitals, pharmacies, local health departments, and federally qualified health centers are in that mix. Now, I know that some parents have been eagerly waiting for this approval. The FDA had scheduled a meeting in February to consider Pfizer's application for this age group before postponing the meeting to await further data from clinical trials. The fact that this process has taken some time is a reaffirmation of the seriousness and the scientific discipline of our approval process, and a reassurance that the approval has not been rushed or based on incomplete data. The Pfizer vaccine for this age group is a 3-shot series. The second dose can be taken 3 weeks after the first, and the third dose 2 months after the second. Each dose contains 1/10 the amount of vaccine that is included in the adult dose. The Moderna vaccine is a 2-shot series, and the second dose can be administered at least 4 weeks after the first. Each dose contains 1/4 of the adult dose. Now, The time appears to have arrived, and parents, of course, can start by consulting their child's physician or other professional provider who will be best able to advise parents about this vaccine. For some parents, the timing may coincide with their child seeing their pediatrician or family physician before the start of the school or preschool year. And perhaps the COVID-19 vaccine can be administered as a part of updating their child's overall vaccine series. Now, I'd like to emphasize how important it is for children to stay up to date with all of their recommended vaccines. And of course, some vaccines are required in order to attend Ohio schools. Now, vaccines protect us against preventable, communicable diseases. In recent years, a slight drop in vaccination rates among our children has led to several outbreaks, like measles, that again are vaccine preventable illnesses. Vaccines for our children include shots for hepatitis A and B, diphtheria, tetanus, and pertussis in a vaccine known as the DTaP vaccine, measles, mumps, and rubella, known as MMR, varicella, which is also known as chickenpox, and meningitis. Now, it's true that statistically, at least, COVID-19 has had a less severe overall impact on our youngest children when compared with other age groups. Children from birth through 4 years old comprise about 6% of our population nationally, but have accounted for about 3.3% of overall cases. They also are underrepresented in the rate of hospitalizations and deaths. Nevertheless, nationwide, there have still been about 2.5 million COVID-19 cases in babies and toddlers, and tragically, nearly 450 deaths among those less than age 5. Now, in Ohio, 79,000 cases have been reported in this age group, with about 1,500 hospitalizations and tragically 10 deaths. So it's important to remember that our youngest children can still fall seriously ill with this virus. Now, I'd like to welcome our guests, Dr. Michael Forbes, who's the Chief Academic Officer at Akron Children's Hospital, and Dr. Grant Paulson, pediatrician in the Division of Infectious Diseases at Cincinnati's Children's Hospital. Thank you both for taking time to join us today. Let me begin with my first question. What can you tell us about the safety of this vaccine, and why should parents be thinking about vaccinating their youngest children when we know, as I've outlined, that they're less likely to develop severe illness compared to other age brackets? And Dr. Paulson, you were involved in some of the vaccine trials. So in this question, maybe I'll start with you and let Dr. Forbes follow up. Dr. Paulson?
Certainly. Thank you, Dr. Vanderhoff. Yes, as Dr. Vanderhoff mentioned, I'm our site principal investigator for both the Moderna pediatric COVID vaccine trial and the Pfizer pediatric COVID vaccine trial. We've been involved with both of them since the very beginning. With respect to safety, to answer the question directly, both vaccines basically demonstrated the same side effects that we've come to expect and anticipate with older children and adults. The most common side effect was pain at the site of the injection. That was normally mild and moderate, resolved within a couple of days. The more systemic side effects that we're seeing more commonly were fatigue, irritability, fussiness, headache occasionally. Fever is often a question when we're talking about new vaccines and new age groups. What they did find was the 2-dose Moderna vaccine series, about 25% of the children had a fever at some point after one of those 2 doses. Fever was a little less common in the Pfizer series at less than 10% of subjects or children that were participating in the trial. I will say these are all relatively expected and within the realm of what we see when we administer vaccines to other children. There were no new safety concerns raised, so there was no incidence of the myocarditis or heart inflammation after the vaccine seen in any of the children in the study.
Thank you. Dr. Forbes, anything that you would add to that?
No, that was terrific. Thank you, Dr. Paulson.
Thank you. Well, let me jump then to another question. So as we're thinking about vaccinations overall, not just the COVID-19 vaccine, but of course, the other childhood vaccinations, some of which I outlined, why are they so important? And Dr. Forbes, let me turn to you to kick off answering this question.
Sure. Thanks for the opportunity, Dr. Vanderhoff. I think when I think of vaccines, we think of them as really one of the miracles of modern medicine. They've been around for a long time. For me, in my line of work as a pediatric ICU doctor, I tend to see the worst of the worst. And so for many of us, I think our motto has been prevent what's preventable. And so through the, as you mentioned, the meticulous scientific attention to this pandemic, we have really rendered severe COVID a vaccine preventable illness, which is incredible in the space of really less than 5 years. And so I think we ought to celebrate that and not take that for granted. In addition to the COVID vaccine, there's a huge lineup, of course, of additional vaccines, all with the intent of preventing severe disease that can either cause death and much more commonly disability. So we've learned from COVID, all of the complications that we see. In the ICU, we see this multiple inflammatory syndrome, where there's a huge cytokine release, a huge inflammatory, life-threatening response after the infection is seemingly abated, or the patient doesn't even know they were infected in the first place. Long COVID, chronic loss of taste and smell, and so on. And so, I think that all of those complications, in addition, of course, we talk about deaths a lot, and we should, but all of the numbers you mentioned, I couldn't help but thinking to myself, you mentioned 75,000 cases in the state of Ohio. Each of those is an individual child. And you mentioned nationally the 450 children who died from this. And so far in our place, and Dr. Paulson, I'd be interested in hearing what you're seeing in Cincinnati, MISC, severe COVID, we're not really seeing those conditions in children who are vaccinated, who are eligible. And so I think the whole idea is to prevent what's preventable, because we do see some inevitable tragedies.
Dr. Paulson, anything that you'd want to add, or anything from experience in the Cincinnati area?
I think Dr. Forbes stated that very well. And we're having a similar experience here. The results and the data are that one of the benefits of the COVID vaccine in the older group, the 5 and above, is it really does decrease the risk of MISC. And just as Dr. Forbes mentioned, that multi-system inflammatory syndrome is as scary or as frequent as an actual COVID infection in children. And so it is one of the benefits. And from my perspective, just to add context with respect to the vaccine preventable infections, just as Dr. Vanderhoff mentioned, the current rates of hospitalization and deaths that were reported for children, those are basically above the rates that we would look at in history for vaccine development for things like influenza, chickenpox, even rotavirus. So COVID has caused more mortality or more death than any of those that we now consider as routine part of the vaccine series to prevent children from death and getting sick with.
Well, thank you. And that's really a very good segue into my next question, which is about vaccine rates nationally having really fallen off, especially for those in the school-aged or preschool-aged bracket. And that's concerning to us as we think about some of these preventable diseases. And of course, now it includes, as you've both shared, access for all children, or soon to be all children, for the COVID-19 vaccine. What's your message as pediatricians now regarding the whole array of vaccines, especially as they may be getting ready to go see their child's doctor over the summer before the school year starts? Oh, and I'm sorry, Dr. Forbes, would you start with that answer?
Sure. Thank you. I think the message is really to talk to your doctor about the vaccines, someone you trust. I've learned, and I think we can all agree that public health is critical, but public health really depends on private choices. And we really want those private choices to be informed by evidence. And the evidence is overwhelming about the benefits of the series of vaccinations that we've afforded to children, where the benefits far outweigh the risk. And honestly, as a parent, we do want to prevent what's preventable. There is information out there that may in fact qualify as misinformation. And that's why, again, I'd recommend that you talk to your physician about what the next step ought to be. And I think it's very important. Again, I'm going to sound like a broken record. We need to prevent what's preventable. When we see preventable illnesses in the ICU, I can tell you it is gut-wrenching for us, for our ER colleagues, knowing that a vaccine would have actually prevented the hospitalization, and for many kids, because again, most don't die, for many kids who end up disabled for a vaccine preventable illness. Again, it just breaks our hearts. So again, get good advice from your provider and really get as many of the vaccines as we recommend as possible.
Thank you. Dr. Paulson.
I think I have very little to add to Dr. Forbes. I think he stated that very well. I would say I do, from my perspective, I certainly do understand that parents felt cautious in the beginning and still feel that way now that we're talking about a new age category. I have two kids that were in that 5 to 11 age group in the fall, and as informed as I am, it was still a conversation with my wife and I on the risks and the reasons to get them vaccinated. So I'd say things have changed a little bit over time. So it's since November, I think we've provided over 10 million vaccine doses to children in that age group. There have been no new or concerning safety signals or events. And I can only emphasize and agree with Dr. Forbes that I think the best place to seek information is to talk to your primary care doctor to get the facts, not the rumor, and make a decision with them.
Doctors, thank you both very much. Let me turn next to another very important issue, and that's the heat and humidity that has persisted through this week and that may return next week if the extended forecast is to be believed. I wanted to provide a few precautions that everyone can take to reduce the risks of heat exhaustion or heat stroke. Heat exhaustion and heat stroke are real dangers in this kind of weather, particularly for our younger children, especially those less than 2, and older Ohioans, especially over the age of 65, as well as people with chronic diseases. Now, some of the safety precautions that people can take include staying in an air-conditioned indoor location as much as possible, drinking plenty of fluids, even if you don't feel thirsty. Scheduling outdoor activities very carefully. If you're outside for any length of time, please make sure to wear loose, lightweight, light-colored clothing, as well as sunscreen, and pace yourself. Now, you can also cool down by taking cool showers or baths or going for a swim. Check on a friend or neighbor and have someone do the same for you. And never leave children or pets in cars. The symptoms of heat exhaustion can include dizziness, headache, nausea, a fast, weak pulse, cold, clammy skin. If you experience such symptoms, please move to a cool place, loosen your clothes, sip some water, and put on cold cloths. And if your symptoms worsen or if they persist, please seek medical help promptly. Well, in conclusion, we've covered a lot of ground today with the help of our experts, and I hope we've provided parents with some valuable information and insights that will help them make the best choice for their children related to all of our vaccinations, including COVID-19. Although Ohio's case counts and hospitalizations remain a fraction of what we were experiencing over the winter, we've seen a modest rise in the past 2 months. It tells us that COVID-19 is still with us. And whether they are young or old, the fact is that the more Ohioans who are vaccinated, the better our chances of avoiding serious illness and disruptions to our daily lives. Thank you. And Ken, I think we can now take media questions.
Okay, thank you, Dr. Vanderhoff. Our first question today is from Titus Wu with the Columbus Dispatch.
Good morning.
Good morning. Hi, Dr. Vanderhoff. I had, some questions on kind of, Ohio was kind of just preparing to kind of roll out these vaccine shots for children ages 5 and younger when it does get approved.
Yeah.
I'm curious, I believe there's roughly around, 700,000 Ohioans ages 5 and under. And you mentioned that that providers are already ordering the doses and hope that comes out Monday. I'm just curious, do you know how many vaccine doses are coming in, broken down by Moderna versus Pfizer? And also I'm hearing I've heard that that much of the kind of the burden of the vaccine rollout will have to rely on pediatricians and maybe children's hospitals because pharmacies have some limitations. I'm not sure if you know anything about that as well.
Sure. Yeah, let me address, that's really an important question. And I can provide a little bit more detail about our preparations to make vaccines available, especially for this youngest age group. First, let me say that it's been clear from quite a bit of research, including research done nationally by the CDC, that for this age group, the parents have a strong preference for seeking vaccination through the mechanisms that they're more accustomed to, which is going through their physician's office, their provider, by and large, as the place that they are looking toward potentially getting the COVID-19 vaccine for their child. And that makes a lot of sense. This is an age bracket in which vaccines are a regular part of well child care. And it's a place that many parents are very comfortable in seeking vaccinations, and COVID-19 vaccination intention, therefore, is not surprisingly among parents around going to their provider. So with that in mind, we actually, over the course of the past period of weeks, have been working with providers, pediatricians, family physicians, in some cases, federally qualified health centers, and a variety of other primary care providers to assure that we had a large number of them signed up and ready to go with vaccine when the approval was provided. Now, we can get you the very specific numbers, but suffice it to say that we, heading into this decision that is expected over the weekend, have a very substantial number of providers who have signed up to receive vaccine. And we have very, very good geographic coverage across the state. Nevertheless, we are continuing to work with some of our other providers who've served us so well throughout the COVID-19 pandemic, including our pharmacy outlets. They are also signing up, and we're very pleased to see that. It is not an issue of not having enough vaccine or a lack of interest on the part of our pharmacies. It is rather, there's a different perspective that parents have with this particular age group in terms of their preference for where they pursue vaccination.
So there will be enough doses to cover the entire age 5 and under population, you think?
Yes, we are looking. So as we've looked at the vaccine supply and the vaccine numbers, we believe we are going to be very well supplied for vaccination, and that parents should be able to access the vaccine fairly readily.
Okay, our next question is from Joe Ingles with the Ohio Public Radio and Television.
Thank you, doctors, for doing this. I want to ask a question. A lot of people are saying, this the most recent illnesses have been more mild. We now have treatments available for if you do get sick that will help take care of it. And the need for vaccines in a lot of people's minds has really gone down. And we've seen that, less than 2/3 of Ohioans have been vaccinated at this point. So are you barking up the right tree here? I mean, and will these therapeutics that are being used to treat now people who get sick, will you be able to treat children with that? Is there any special case to make for getting these young kids vaccinated?
Thank you. I think that's an excellent question. Let me begin by reminding everyone what the purpose of the COVID-19 vaccine is. How does the vaccine really work? And the vaccine is designed to protect us against serious illness. It's designed to prevent us from developing either an illness that lands us in the hospital or, God forbid, kills us, or causes serious complications, serious disease, like the multi-system inflammatory syndrome in children that Dr. Paulson referenced. And the vaccine has shown itself to be continuing to do that extremely well. So even though, yes, many people have had COVID-19, the fact remains that we have an option, we have available to us a very safe mechanism for reducing our risk of developing severe illness, regardless of our age, in the form of vaccines. And as physicians, what we are saying is, look, we think this is the best option for providing you with protection against that severe disease in a very, very safe format. I'd also add that there is now lots of research demonstrating that the best protection is what is known as hybrid immunity, the immunity that people gain from a combination of having had it and having vaccine on board. And frankly, it is never too late if you're in that third of people 5 and up who have yet to receive the vaccine. It's never too late to avail yourself of that hybrid immunity. But I've got 2 physicians on who know a lot about this. And let me turn to them. Dr. Paulson, because of your work in vaccine development, let me give you the first opportunity to add to what I've said.
Thank you. I guess, as Dr. Forbes and yourself just mentioned, the prevention is really key. And so I will not reiterate all of that. Any illness we can prevent, we are way better off than trying to treat it. With respect to the question specifically regarding options and treatments for young children, and I agree, we have gotten kind of used to COVID to some respects. For younger children, the treatment options are still relatively limited. We've gotten much better at this, and I'll defer to Dr. Forbes for some of the more critical care aspects. But a child under the age of 12, certainly these younger children, they're not approved, or it's not able to give them the oral medicine, which is Paxlovid. We're not approved or able to give them the intravenous monoclonal antibody either. Really, the only treatment option for those young children is an IV infusion that is once a day for between 3 and 5 days or longer if they're critically ill. And so a single vaccine or a series of vaccines that can prevent serious illness that brings a child into the hospital, into the intensive care unit, is much preferred in my mind than a 3-day IV infusion in a hospital setting. And so I'll stop there and happy to answer or expound on questions.
Thanks, Dr. Forbes. Given your experience and knowledge as an intensive care physician.
Yeah, I think what I would add is really just to echo what's been said, and that is the vaccines are not to prevent the common cold. They're not to prevent the mild, kind of annoying illnesses. They're really meant to save your life and prevent disability. And so I think when we ask the question, why would we bark up this wrong tree, which I think a totally legitimate question, because it seems like we're on the back end of the pandemic. The disease is kind of waning. We have a lot of natural immunity. We have vaccine and hybrid immunity. Why would we do this? we are still seeing severe COVID in ineligible children, immune compromised folks, and folks are still being hospitalized due to COVID. So we're not done. And so if you have an opportunity to prevent severe disease, that's the question. Can I prevent severe disease? It's not the millions of children and adults who've had it, who walk around and say, I had COVID and I'm fine. It's really, do you want to prevent severe disease in this age group? Do you want to reduce transmission even further? Then you go ahead and get vaccinated. And again, hybrid immunity appears to be really superior to getting it naturally. So getting your vaccine still makes perfect sense even today.
Okay, our next question comes from Maya Belay with Fox 8 News Cleveland.
Hi, everyone. Thank you for taking my question today. This is for whoever wants to answer. Just wondering, can you talk about the demand for this new age group related to vaccinations, and what percentage of vaccinations for this group, say a month from now, would be deemed a successful launch?
Yeah, I'll be happy to field that, and my colleagues can add it if they feel there's anything to add. Look, as we don't have any experience, obviously, with vaccinating this age group with this vaccine. So everything in terms of prediction is a guess. However, when we have looked at surveys of parents, it does appear that there are parents who are very eager to get their children vaccinated and will likely, as soon as the vaccine is available, be making appointments to get that done. We also know that there are parents who are interested in the vaccine, and we're encouraging them to get their questions answered that they may still have, especially by talking to their child's physician or regular healthcare provider, because the medical community is very for me and impact on our youngest, very knowledgeable and ready to go on this. You know, in terms of what would be a success, you know, personally, my feeling is that every child that we're able to make the vaccine available for is one more success. You know, would I like to see all of our children taking advantage of this wonderful opportunity for protection? Of course, I would like to see that, but I do understand that this is a very important decision among many that parents make, and they want to make thoughtfully and after due consideration. But as physicians, I think what we're trying to convey is we see this as a very safe mechanism for providing a shield for your child against serious illness. It is one more vaccine preventable serious illness in the list of vaccine preventable illnesses now becoming available to all children in Ohio. Let me turn to my colleagues, Dr. Paulson or Dr. Forbes. Anything that you would add?
Nothing to add, honestly.
No, I think you stole my line. I was going to say I think every child that we can make available this vaccine to is, and that we're able to vaccinate, is a success.
Okay, our final question today comes from Danny Eldridge with Hannah News Service.
Hello, doctors. Thanks for taking our questions. So I just kind of want to clarify, is ODH ordering and paying for these vaccines and distributing them? Can you just talk a little bit about how that process works? And then also realistically, when will parents be able to get appointments? Will they be, will they be ready on Monday is a holiday, obviously Juneteenth. So Tuesday, Wednesday, what should they do?
Yeah, thanks. Great question. So this vaccine, the vaccine, which is going to, we hope, be made available for this youngest age bracket, will be exactly like, from a payment point of view, the vaccine that's been made available thus far to all the other age groups. So this is coming to us through a federal program. The federal program is one that the Ohio Department of Health is coordinates or helps to manage at the state level. And we have worked very actively over the course of the preceding weeks with our provider community to get vaccine pre-positioned out in practices so that shortly after, almost immediately after the vaccine receives full approval and with appropriate guidance from the CDC, practitioners will be able to have vaccine and deliver that to patients. And we're continuing to work through all the channels that we've worked through for the vaccine for the other age groups. So while today we're talking a lot about providers, pediatricians, family physicians, federally qualified health centers as locations to get the vaccine, it's not limited to those. We're talking a lot about those because surveys have suggested that tends to be a preference for parents of children in this age bracket. But you'll have the opportunity to seek this vaccine through other avenues as well. And my colleagues, I don't know, this is sort of more in my wheelhouse, so I don't know if you've got anything that you want or need to add, but you're certainly welcome if you do. Okay, thank you. Well, thank you all for joining us again today. I really appreciate it. I want to express a special thanks to my guests, Doctors Forbes and Paulson, for sharing their expertise as pediatricians working in this area, and appreciate all the consideration that parents will be bringing to this very important opportunity as we look forward to the likely approval of vaccines for this age group over the weekend. Thank you.
This concludes today's press conference. Thank you again for joining us.
Thank you.